Hello, everybody, and welcome to the Art Beauty Podcast, where we tell the real truth about the fake shit. We are unbranded, unsponsored, and quite frankly, unafraid to ask all of the questions that we know you want the real answers to. Today, my fabulous co-host is Dr. Pamela Hunte. She is my dentist, full disclosure. Look at my beautiful teeth. And thank you for that. Thank you for being with us today, Dr. Hunte.
Thank you so much for having me. This is my first time on a podcast, so I'm kind of excited.
Oh, well, welcome. It's a lot of fun. We'll try to make it easy on you.
It'd be nice to me.
So I wanted to talk to you because I feel like now with Zoom, people are so focused on how they look, right? It was like when plastic surgery took a real big boom when social media started being so big. And now that we're all on our computers, I think that people are really focused more on the face than ever. And with that, it's teeth. And I wanted to talk to you because I feel like there's so many different potions and gadgets out there for teeth whitening. And, you know, if people use the wrong thing, it can be dangerous. So can you tell us a little bit about what sort of teeth whitening procedures you offer in your office?
Okay, sure. So, you can do two different things. You can do in-office whitening. You can do over-the-counter products. So we offer a type of in-office product called Glow, which I happen to love, which is done during a 2-hour appointment. Very, very low sensitivity. A lot of the in-office whitenings out there cause like crazy sensitivity.
Yeah, my girlfriend had it done and she said it was the most pain that she's ever been in.
Yes. And I've had other brands done on my own teeth and I was just like out of my mind. So I've spent so long trying so many different ones and we finally settled on this one and I haven't received any complaints for sensitivity.
Great.
So it's good. So, we place the product in several steps. With a light. You also get a light to take home. So you can do some whitening at home safely yourself.
Now, is this Glow piece, I've seen them, I feel like I've seen ads on Instagram for this. So the at home you can buy separately without having the procedure done in the office?
Yes, you can, but it's super low percentage. So if you're looking for, a few shades, you're not going to get it with that. So it's better to do,
Yeah, sometimes I have to ask, like, I wonder if like these at home, lights and everything, like, do you think they really work?
They do. Okay. But you've got to like set your expectations, depending on what you do. So like your teeth are beautiful and white. If you just wanted to do a little brightening, you could do that.
So I've talked about it on this podcast before. I use Crest white strips. I love them. Yeah. But I also know that when my husband, who also comes to you, wanted to whiten his teeth, he needed something a little bit stronger. But he didn't want to do the in-office. He does not have a high pain tolerance. He did the trays with the gel.
Right. Yeah.
And I swear the first time he put it in, you would have thought that, like, I don't know. It was not pretty. It really hurt him. So is there anything for people with sensitive teeth? Like, is there anything that we can do?
Yeah, there's products, over-the-counter products that say for sensitive teeth. So you would buy that. With the in-office stuff, you would do like extra fluoride treatments. We can like pre-treat you. So you can use those trays. You can do fluoride at home for like a week before. We can give desensitizers, sensitive toothpaste. There's stuff to mitigate that if we know that that's going to be an issue,
That's great to know. So if you're a person who has sensitive teeth and you want to whiten, don't count yourself out. You can actually talk to your provider and get some prep for that.
Yes, absolutely. We can totally do it.
Now let's talk about percentages, because you were mentioning that before.
Yes.
The active ingredient in most of these teeth whitening is hydrogen peroxide, correct?
Yeah, it's two things. One's carbamide peroxide and one is hydrogen peroxide. So the one that we do is like a high hydrogen peroxide, which you cannot do safely at home. Like that would probably burn your gums somewhat if you try to do it yourself at home. So typically the hydrogen peroxide stuff at home, I would say it's probably like around 10% hydrogen peroxide.
Okay.
Yeah. So then the other stuff is what we give for the take home trays. It's a different material and you can actually sleep with it for several hours and it's safe to sleep with. That's the carbamide peroxide.
Okay.
So
and then the one in office,
yeah.
like what's that? What's the hydrogen peroxide that we're getting there?
That is 35%.
Yowza. Okay.
Yeah.
I feel like
so that needs to be done carefully.
I feel like the trays that you made for my husband were custom fit.
Yep.
Right. Because they can't touch the gum. That's a big, you mentioned that before, but you can actually cause severe gum damage if you're using this incorrectly.
Correct. Yeah.
But I think his were way stronger than just like the Crest wipe strips. So maybe it wasn't
so
35.
Well, it depends on what we gave him. So it might have been 35% are the ones that you can only do for an hour. You can't sleep with them.
That's what you gave him.
That's it. Yes.
Yes. Okay. I mean, it made a huge difference. But we talked before about managing expectations, right? So if you're going to do a home treatment, you're looking at sort of an overall brightening, whether you have been, you see coffee staining, or maybe you've got a little red wine. Right. But what about for people who have white marks on their teeth? Does whitening affect that at all?
No, that's a really tough situation, especially when they're like on those central incisors.
Mm-hmm.
What's going to happen? I mean, you're going to whiten your teeth, but they're still going to be there. And I have people coming in all the time and they're just like, oh, I'm just going to whiten, and they'll disappear, and they don't. So
yeah,
it's a tough one. So there's a couple of different things you can do. I mean, unfortunately, the usual thing is to place veneers on teeth like that have severe white spots.
I know, but you can do if you've mild ones, you can do a paste, correct?
Yes, there's a paste called MI paste, and it's done in a custom bleaching tray, and it takes some patience. It can take months.
Yeah,
of treating yourself with that MI paste at home.
But I've done it. Yeah, so is my husband. That's the reason I know that. I'm totally throwing him under the bus right now.
Yeah. But I mean, it just takes a little patience, and it takes quite a long time, but you can get results if you do it right, and it can be done for sure. But they're still somewhat visible, I think.
Yeah.
So if you're looking for perfection,
right. We're going to get to perfection in a minute, because I want to talk to you about veneers. But what about things at home, just like gargling with hydrogen peroxide? Is that something that can be done?
It can be done. I don't know how much that is going to whiten your teeth, because you need it to be in contact with your teeth for a significant period of time. So it's not harmful. It'll probably, if you rinse with it, it'll probably be better for your gums than for whitening.
And then what
killing
about
bacteria?
What about all of those whitening toothpaste then? So is that we're about to get real here. Is that kind of is it kind of BS? Because you're right. It's not on your teeth.
Totally BS. I have used every new whitening paste myself. I buy it and nothing.
Wow, because you're right.
Nothing.
It has to be on your teeth. Even the Crest white strips, they have a 1 hour version, which I don't recommend. I like the half-hour versions. They do the trick, and then your teeth don't get really sensitive.
Yeah.
Because with the Crest white strips, look, the difference between having the custom-made trays is, again, the custom-made trays are going to make sure it doesn't hit your gums. The Crest white strips, you gotta carefully kind of put it on and then just hope for the best.
Yeah. So the one thing I wanted to say about those was that most people don't know when they buy them that they're usually cut to only whiten your 6 front teeth.
Yes.
So that's a big disadvantage. So if you want to whiten beyond those 6 front teeth, you might want to consider something else.
Smart. Yeah. Because some people have a much more a toothier smile.
Right.
So, okay.
Toothpaste. Yeah.
Glad we totally just debunked the toothpaste. Sorry, but Crest and
I know, sorry,
Colgate and all your brands out there, but
I know.
And then on some of these like UV devices are like a maybe that you see at home,
I
like
would say they're a maybe. I think they're better than some of these paint on things. Like you'll see stuff that'll say, oh, just paint it on your teeth.
yeah,
And then your saliva just washes it off.
good to
So
know.
those to me they don't make a bit of sense. But if you're putting something on and then you're putting something over it, like that UV light, that has a better chance of working,
Now,
I think.
I don't know offhand. Do you know offhand like the ballpark pricing for some of these at-home UV lights?
I know I've seen the glow. I've seen the glow at home on Amazon. I want to say it was like $160.
And now what is a whitening treatment in the office? We know that prices can range. I know you're a New
Right.
York dentist, but,
Right.
but ballpark, what is like a whitening
For
procedure
the
in office?
glow, it's about 700.
Okay. So,
And
I
that's
mean,
inclusive, of that stuff to take home. You get the light, the bleach, the 2-hour treatment.
so it's considerably more, I mean, in the
Yes.
spectrum of things, but
Yeah.
is it guaranteed results?
Yeah. We take a really good look at your teeth, and I've gotten pretty good at predicting what
Mm-hmm.
types of enamel are going to give you a good result. So we try to tell you what to expect. Are you going to go 2 shades, 3 shades?
Right.
Some people require more whitening at home to, take them the rest of the way.
And on that
So
note,
people
though,
should expect that.
there is also a thing you want to be careful because there's a thing as too white. You don't want to look
I don't know.
unnaturally. I've seen some big chiclet smiles. Maybe it was just bad veneers, but sometimes we were
I
like,
think those are
oh,
veneers.
yeah,
I
they
think
are.
those are
You're right.
veneers. I don't think I've ever had anyone whiten their teeth and go, "Oh my god, my teeth are too white."
Are too white. Fair. I mean, fair enough. I mean,
Yeah,
I'm
yeah,
get them
yeah,
as white as they can. All right.
yeah.
So let's jump into the veneers, right?
Okay.
Because that is for something like if you are actually, no, before I get there, I want to remind
Yeah.
people too that you also can't whiten certain types. Like if you've had a cavity or filling and they do the white, like that doesn't whiten, correct?
That's correct. So if you have bonding, a crown on a front tooth, everything's going to whiten but that.
Okay.
So
What are our
that's,
options in that case?
replacing
Mm-hmm.
what's there. So, I mean, if you really want to whiten everything around it, you would have to whiten, then replace.
Now you have, for me, I have like my two like canine teeth. What are the
Right.
incisors?
Right. A
Whatever
little
those two
bonding.
teeth are called. Yeah, at the top because I've got
Yeah.
like I had some gum recession and you put the
Right.
white bonding in there and it's
Right.
fabulous. But I remember that you were like, if you're going to whiten, we need to know because that won't whiten.
Yes. You should always have that discussion first because there's no going back from that. You get veneers on your front teeth and then, and you decide to whiten everything else beyond it. You're kind of stuck.
Okay, so I feel like let's jump into veneers
Okay.
because I feel like more and more people are talking and like pursuing cosmetic dentistry, but this is like kind of like the facelift of cosmetic dentistry, correct?
Yeah, it can be for sure.
Okay.
Um, it's a beautiful treatment, and it just depends on what your goals are. It can close spaces, it can cover white spots, large bondings that have failed or gotten discolored. That's where we start to think about veneers.
All right. So let's go right. What is a veneer?
So a veneer is a facing that bonds right to the front of your tooth. So I would say the big downside for most patients is you have to take tooth structure away. So
Okay.
because if you just plopped ceramic on the existing tooth, they would be sticking out too far.
Right.
So you need to take a little tooth away. I mean, we're talking about 2 millimeters of tooth, but it's still tooth. We're still drilling down your tooth.
Is it something like once you get veneers, you really can't go back? You're always going to need to have veneers?
Yeah.
Yeah.
Yes.
Okay.
For sure. Yeah. Because once
So,
that tooth structure is taken away, that's that.
and like, how long do they last?
I mean, I have patients who've had them for 20 years,
Okay.
as
Right.
long
If
as
you're
they're
a hockey player,
taken care of.
yeah, your teeth.
Yeah, but yeah, I mean, obviously, if there can be things, if you traumatize a tooth, they can break. But they hold up nicely.
And would you say that veneers, like when you see somebody who has like a totally beautifully remodeled smile, most often it is, like I come into the dentist office, I come into your office and sometimes there'll be like
Yeah.
books on the table and you'll see these like really very, God, I don't even, teeth that are not so good. And then it's like
Yeah,
the after is just supermodel smile. Is that
yeah,
veneers
that's
generally?
veneers.
Okay.
Yes, for sure. Yeah.
So the process with that is that they shave sort of, or they drill down the front of the tooth.
Hmm.
Ooh,
I know.
oh, I don't like it. And
I
then
know.
you're essentially gluing on
Yes.
a bright,
So it's
shiny.
porcelain, ceramic of some kind, depending
Okay.
on the situation.
And what ballpark prices on these types of things?
So they're about 2,500 per tooth.
Per
So
tooth.
per tooth,
How
yeah.
many teeth do we have that we would need to do that to?
It depends. I mean, the 6 front is ideal. If you're really going for a nice cohesive look, you want to have those 6 front teeth.
Okay. Okay, gotcha. So,
Yeah.
this is an
So
investment,
it's
but an investment that if you were to take good care of could be something that's going to last many, many years.
yes, for sure.
And then probably even
And
if there was a damage to one, it's not an
you don't have to replace everything because things happen. I mean, there are accidents. People bite on a fork by mistake and crack a veneer, So it's a simple thing to just replace the one.
Oh my gosh. We went to an Easter egg party once, or an Easter party where they did an
Uh-huh.
Easter egg hunt. And my poor father picked up this little, what he thought, and it looked like an Easter candy, and it was a
Oh,
marble egg and
oh
bit
my
into it.
gosh.
It was
Uh,
not good.
oh my God.
Broke
I've
his
had so
teeth.
many people, staples, bitten on staples, things
Sure.
in, shells in food. I mean, all kinds of crazy stuff. Yeah.
So okay, if we are thinking about this and our teeth are something that we're concerned about, as a
Mm-hmm.
professional,
Mm-hmm.
do you feel like it's something that we should try an at-home treatment first before, taking the plunge, or what are your suggestions?
I think it's not a bad idea. And you're not spending a ton of money. So you haven't outlaid, $700. And, there's a lot of people that might get a really super nice result from at home. And
Right.
then you're fine. And there's no harm in then being like, you know what, I want to take it to the next step and
Great.
doing the in-office. So I think that's a
Amazing.
great idea.
Amazing. If people
Yeah.
want to talk to you, if they've got questions, if they want to find you
Yes.
directly, what's the best way to find you?
My website is PamelaHuntDentistry.com. So that's a really good way to get a look at our office, and you can request an appointment and send us a message. We would love to have new patients.
Yeah. Oh,
So that
wait a
would
minute.
be
And you do
awesome.
referral bonuses. So wait a minute. No, never mind. If you want to
Oh, we
find
do.
her,
I know.
you reach out to me, Amber at Art Beauty
Yes.
Podcast, and I will send you. No, seriously.
And then you'll get a nice present from me.
It's okay. Honestly, you've been so
Yeah.
great with me. You take care of my husband
Sure.
and myself. And,
Yeah.
listen, your teeth, you only get one set in your life. So I feel
Right.
like that is an area that you want to invest in. And certainly taking, going for your regular checkups is
Yes.
key,
So
right?
important.
And
Yes.
especially now, what about now during COVID? We're kind of coming out of it, but some places in the country have it really bad.
Yeah. I mean, I definitely wanted to make a note of that. I think people should feel really good about going back to their dentist. We're good at infection control during the best of times. So this was like right in our wheelhouse. Like we know what to do. So
Right.
I think people should feel safe, and they should call their dentist and ask if they're not sure, what they're doing. I mean, we have UV lights, we do electrostatic disinfection, like we're in full gear. So, I think people should feel safe and good about pursuing their dental treatment.
I was with you. Like week 1, it opened up and it was like,
yes.
Here's what I did that day.
Yeah.
I walked 40 blocks to come and see you and get my teeth, you know, cleaned. And then I walked 40 blocks to get Botox. So, you know, all the important stuff going on here.
Right.
Thank you so much for being with us, Dr. Hunt. And of course, if anybody has questions, you can always reach out to me. I will pass them on to Dr. Hunt. You can reach out to us at Art Beauty Podcast, Hello at Art Beauty Podcast, Amber at Art Beauty Podcast. They all go to the same place. You can also find us on Facebook and Instagram at Art Beauty Podcast. And as always, we will see you next Tuesday. Bye.
Thank you, Amber.